I'm Dr. Ogba. I'm the consultant psychiatrist. I heard that you're needing some help with more.
Yes, yes.
What's been happening?
He's on a section 136. They brought in admitted. Yeah.
Okay.
Do
you have any history?
A bit bizarre. Well, I've got some information here.
Okay.
That's all. I'm fairly new to this. It's my first day of
Right. Okay, let's see. So, more than related behavior, okay.
I was a bit concerned. It's a bit cold.
So it's not just sleeping, it's cold, clammy.
Yeah.
Not taking meds.
Oh wow, you are gorgeous.
Hello, Morgan.
Hi, what's your name?
My name is Dr.
You're
Ogba.
beautiful. Look at the colouring on your beards.
Morgan, come and have a seat. Let's
Oh
have a chat.
wow,
Come
wow.
on, Morgan.
Mickey, can I have a hug?
No, Morgan, have a seat, please. What's happening? Come and have a seat.
Okay, yeah, no problem, no
Let's have
problem.
a chat.
That's fine, man. That's fine. I'm happy with that. Am I okay on here?
Morgan, please have a seat. Yeah.
Can I sit here? Is that okay?
Well, you can sit there.
That's fine.
Yeah. Okay.
So, Morgan,
I don't want to miss you out as well. You're lovely as well. And you too.
Morgan,
Yeah.
I understand you've been picked on the 136 and you've been brought to the school.
Okay, right, okay.
So, would you mind tell us what's been happening?
Well, my understanding is I think you're here to better understand my body and the special powers within it. Does that sound good?
So you have special powers?
Yeah. You can come and check them.
No, it's okay. It's okay. You can tell us more.
Oh yeah, that's so actually.
Sorry.
Yeah.
Whilst I was just checking this off, you complained of chest pain.
Okay. Morgan, are you having...
That's why he's doing it.
So you haven't chest pain?
Yes.
Morgan,
Yeah.
we've come to help, okay? It
Yes.
would be helpful if you can tell us what difficulties that you're having at the moment.
Yeah. Well, I mean, people tell me that I'm doing great. Like I've got bounds of energy. I feel good. I've got connections to the Almighty. I've been doing some work for the Almighty.
Okay.
I
can see you're quite you're quite energetic.
Yeah, I've got a few jobs. I've been doing some stuff on the roads. As well as that, I've been doing some childminding.
Okay.
And I've got another job as well at a club, which is where I've got this on.
Okay. Morgan,
Yeah.
you said you were having some chest pain.
Yeah.
If you can have a seat, we need to check you out to make sure that you are okay.
Okay, sure, yeah.
So can we get some set of ups, please? Like this blood pressure and pulse and stats, please.
Can you
Okay.
tell us more about this chest pain?
Yeah, well, it's, when I try not to think about it, but I think if I really focus on it, it's quite strong. It's growing. I think maybe like 8 out of 10 actually. It's pretty 10. Strong. Yeah, but my body is. Yes.
And how long have you been having this pain for?
Yeah, an hour and a half, and it's going into the shoulder.
On the left shoulder.
Yeah.
Is it going up to your neck?
It's creeping up there. Yeah, it is. But I think my body's so strong. I don't think it matters. I think I can deal with this myself.
So we need so we need to check his blood pressure, his pulse, please, and his oxygen saturation.
It's okay. Morgan. Yeah.
Morgan, please have a seat.
Okay, yeah, no problem. That's fine. Oh, just wait. I need that for the child money. I got it.
Are you on medication, Morgan?
Ooh. I don't need medication at the moment. My body can deal with everything.
But are you on medication?
I'm not taking anything. No, nothing at all.
No, nothing at all.
Okay.
So you were supposed to be on lithium.
Okay.
Have you been taking it?
No, I haven't had that for a few days. I've been feeling so good. I just don't need it.
And then this chest pain.
Yeah.
Is this the first time you're having this pain?
I've had needles, but I've never had this before.
Does it feel as if somebody's sitting on your chest, Morgan?
Yeah, it's a strong pain.
It's a strong
really
pain.
strong. Yeah, it's like that, and it's this arm as well.
Blood pressure is 160/100.
160 over 100.
Yes, so that's 94 now.
So that's 90. What about his
Pulse
heart
is
rate?
100 now. Yeah.
Were we able to do an ECG?
Just before you came in, yeah.
Okay, yes,
Can we
because
have a
Oh, that is strong actually. That is strong. I think I can, my body's.
I know you're feeling strong.
Yeah.
But I'm really worried about you.
Okay.
Because what you're describing could be a sign that you're having a heart attack.
Okay, I can deal with that though, I think. I'm.
Still elevation, yeah.
You see, when did we have this? When did we
So
take
just a
this?
few minutes before you came in.
2 minutes before.
Yeah.
Okay.
Yeah.
Yeah.
That's fine.
I think we're dealing with a case of.
Can I look at this? I can read that for you, I think.
Coronary syndrome because
No.
Morgan is complaining of very
Yeah, I'm gonna be.
very severe chest
I
pain.
don't know if I said I'm going to be a doctor.
Okay.
And also the fact that
I've got offered a place at the medical school. I'm going to start soon. It's one of the jobs that
I
I've
think
got.
we need to.
And that looks, I'll be honest, that looks pretty good.
We'll have a chat about it.
Okay.
I think while we're doing that, I think we need to call the medical registrar
Okay.
because he
I
could
think
benefit from
I'd make a good doctor. I think.
Morgan, you're doing okay.
Yeah.
But we are worried about you.
Okay.
So we need you to just calm down.
Yeah,
lie
that's
down.
nice, Dr. Robert. Thank you.
Thank you very much. And then what we need to do is because of this chest pain that you're complaining of.
Yeah.
I'm really worried about it. And then the ECG that we've just done on you.
Yeah.
It shows that you are having what we call a heart attack.
Okay.
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 So we
I'm
need
just
you
going to
to.
move around a little bit. I think that will help.
No, Morgan, you need to. We need you to stay in one place.
Yeah. Okay.
And what we're going to do.
Hello, Simulation Centre switchboard.
Hello, please, can you put me through to the medical registrar on call?
Medical registrar at University Hospital North Durham
Yes,
or
yes,
James
yes.
Cook Hospital?
Any of them? Sorry, not Durham is fine.
Okay, I'll get you medical registrar. Headline.
Yeah. For pain. Oh yes, we don't have any. Okay.
Yeah.
Help is coming.
Okay.
So what we need you to do is to try and calm down, and then we're going to speak to the medical.
Hello, it's Jess Smith, medical registrar.
Hello.
Hello, medical registrar.
Hi, my name is Dr. Okeke. I'm one of the psychiatry registrar.
Hello.
Hello.
Yeah. Hi. Yeah.
I would
How
like to
can I
discuss
help
a
you?
patient with you. Okay, there's a patient of ours who is a 56-year-old male, Mr. Morgan.
Yeah. Okay.
He presented with manic episode. However, he has complained of chest pain, and the chest pain is radiated to the neck. And an ECG was done, which showed features in keeping with a myocardial infarction. Physical observations done also showed some derangement in his blood pressure and his heart rate. So we're thinking he might be having a heart attack.
Right. So you think he's having myocardial infarction? When you say he's got derangement in his ECG, what's it showing?
Yes, it shows elevated ST elevation.
Okay. Which leads?
It shows on the anterolateral leads, anterolateral myocardial infarction. Hello?
Okay. Which leads? Sorry, anterolateral leads. So.
Yes, anterior and lateral leads.
So what, V2 to V6, is it?
Yes.
And how much is the ST elevation?
ST elevation, it's about sorry, not quite sure, but it's God.
Okay. Have you got previous ECG to compare it to?
Sorry, I've not confirmed that, but I'll try and ask around for that. This was done a couple of minutes ago.
You probably won't have, if he's in a psychiatric wing, you probably won't have access to his medical notes, I'm guessing.
Yes, sure.
Right, okay.
So,
Right.
at the moment, we're monitoring his observations, and we might like to just give him aspirin for now, and maybe GTN spray. Is there any other thing you recommend?
So you've given him GTN spray. Have you given him any aspirin?
No, we've not given him anything yet. Well, it's something we'll try and find out if they have.
Right, okay. Are you able to email the ECG to me?
Okay.
If you can email it, scan it. If you have the facility, scan it and email it to jamescookccu@nhs.net.
Okay, great. His name is Morgan Jones, date of birth, 8th of February 1966.
Great stuff. When you say he's got signs of chest pain, how long's it been going on, and is it a convincing cardiac chest pain history?
Yes. It's radiating to his neck and his back as well.
Right. So, and it's central. It doesn't sound like a aortic dissection. You say when it's radiating to his back. Where's it radiating to in his back?
That's true.
Is this sort of between scapula? Could this be a dissecting aortic arch?
Yeah, it's a possibility, which is that's one of our differential. Is there anything you want us to do to rule out aortic dissection?
I mean, it's just all in history, but I mean, if he's got ST elevation in his anterior lateral leads, it's probably more STEMI if this is new ECG changes. Has he had this type of pain before? Has he had an MI before?
My senior colleague is currently speaking with him. Has he had this type of pain in the past, Dr. Opa? He has not had it in the past, but there's family history. Yes, there's family history of cardiac conditions.
So he's got family history. Has he had this pain before? Has he had MI before or anything?
No, he has not had any cardiac issue in the past.
No cardiac. Has he got any cardiac risk factors?
Except any cardiac risk
Is
factor.
he a smoker, hyperlipidemia, hypertension?
Does he smoke? Does he smoke? Is he hypertensive? Sorry, let me check. He has raised from his physical history. Sorry, just to go through. Yeah, he's a current smoker. He's 40 pack years. He drinks alcohol, 2 pints of lager a night. Occasionally, takes cocaine, cannabis, and that's the palm use as well.
Oh, he takes cocaine as well,
But
right? Okay.
Yeah, but he denied using any of this today.
Right.
Yes.
Okay. How old did you say he was? I do apologise. You give me a date.
I'm 56 years.
Right, okay. Right. I'll have a look at his ECG straight away if you email it, and then
Okay,
I think,
so
we'll
to ask, should we hold on the aspirin for now to get a look at the ECG?
yeah, just hold off just for a minute. We'll have a look at
Okay.
this ECG, make sure it's more sort of coronary
Okay.
syndrome type picture, and then we'll
Okay,
think
I'll
about
send
aspirin.
it straight
You
away.
won't be able to give him heparin in your unit, will you?
I don't think that is readily available in our unit. Yeah, it's just aspirin we have. So yes, I will send it straight away. We don't have. Hello.
Hello. Yeah.
We don't have heparin. We're not able to get our hands on that.
All right.
around
Well,
here.
send the ECG, and I think what we'll do after that, if the ECG looks convincing, and if you can have and there's no previous ECG, then we'll blue light him over here straight to James
Okay.
Cook CCU. But let me have a look at
Okay.
ECG first, if you would.
Okay.
What's your number I can contact you on?
You can contact me on 01642 55723.
Okay, thank you very much. That's great. I'll be
Okay,
right back
thanks.
once I've seen this ECG. I'll look at it straight away.
Okay, sure.
What's your name,
thank you.
doctor?
My name is Dr. Okeke.
That's great. Thank you, Dr. Kiki.
Okay, I await your call. Thank
Bye.
you.
Very kind.
So, Dr. Oba, the medical registrar said he would like to take a second look at the ECG and get back to us.
You want to take a second look at the ECG?
Yes, just to ensure it's actually like cardiac infarction. Another thing he might be considering is aortic
But
dissection.
I'll just go and I need to put the cones out before I sit down, right?
Presentation, and if we do this,
But we need he needs to go to hospital now.
he said he will ring me now as soon as possible.
Is it ring? How long is it going to take him to ring back?
It wouldn't take a while. He will ring me straight away. I'm awaiting his call.
I'm really concerned, you know.
Yeah, that's fine. I suggested aspirin. He said we can hold on that for now. He'll ring me back. So I think I will just wait for him. If I don't hear from him in the next 2 to 5 minutes, I'll ring him again.
Because I'm really worried about Morgan. He has risk factors. I mean, he's a smoker, and he does take drugs, and then he also has family history. And then with the chest pain, which he's having at the moment, which the intensity